The broadcast is now starting. All attendees are in listen-only mode.
Good morning. We will get started shortly. We see that we have many attendees still getting logged on. So give us a few minutes and we will begin this training. Good morning. Before we get started, we need to let you know that this session is being recorded. By participating in this session, you are consenting to the recording, retention, and use of this session. During this session, your microphones are muted, so if you have questions, we encourage you to put them in chat. The Department of Human Services is pleased to offer this training session for pharmacists wishing to enroll in the Pennsylvania Medical Assistance Medicaid program for participation as a mid-level provider. We have several staff assisting with this training. My name is Sandy Migliarese, and I'm the Division Director for Provider Enrollment. From our Deputy Secretary's office, we have executive assistants Lena Aletta, who will be monitoring the chat for any questions. Assisting Lena is our Bureau Director, Michelle Robeson. Our trainers for today's session are Benita Bishop, Provider Enrollment Supervisor, and from our vendor, Gainwell Technologies, Provider Services Manager, Lana Elias. And with that, I will hand it over to Lana.
Thank you, Sandy. Good morning to everyone. I do want to welcome you all to the Pharmacist Enrollment and Billing training this morning. Sandy's going to be running the slideshow, so let's get right into it. We do have a lot of material to cover with you, and we want to make sure that we get to your questions at the conclusion. So this morning, our primary topics are going to be the Affordable Care Act overview. We'll then talk about pharmacist enrollment requirements and accessing the enrollment application, the completion of the enrollment application, and also how to resume an application or check the status of an application. Moving on, we will talk briefly about some MA regulations with regards to claim submission timelines. We'll review the Promise Portal registration process, talk about recipient eligibility. We will go over the Promise Provider Portal and the billing portion. We'll review the remittance advice statement and how you would retrieve that. And then finally, at the conclusion, we'll review some resources that are available to you and then answer your questions, some of them. So moving on, Sandy. So the Affordable Care Act requires that all states comply with provider screening and enrollment regulations, and they can be found at 42 Code of Federal Regulations 455. provider screening and enrollment requirements. Now, as required by the Affordable Care Act, all practitioners, including those who order, refer, or prescribe items or render services for MA beneficiaries, must be enrolled in the medical assistance program. Additionally, the ACA regulations require that the states revalidate their enrolled providers every 5 years. So I just want to make note that this training does not address MCO plan credentialing or contracting questions. Those you would need to address to the various MA managed care organizations themselves. Now, effective March 1st, 2024, individual pharmacists will be able to enroll in the medical assistance program. You will be enrolling as a provider type 10, which is a mid-level practitioner, and your specialty code will be a 247 for pharmacists. Now, if you are a pharmacist and you work at multiple service locations or offices, you want to enroll each of those locations at which you're going to be providing these services. So it's only applicable to these new services that you would need to enroll each of your sites. There is an MA bulletin out there, 10/24/02, titled Pharmacist Enrollment in the Medical Assistance Program. I would encourage you to review that bulletin if you haven't already. Also, keep in mind that the application itself will not be available to you until March 1st of this year. So if you tried to do it today, it's not going to work. So again, if you're accessing the application, so for pharmacists who are planning on enrolling in the MA program, again, you will be a provider type 10 with a specialty code of 247. In order to access the application, you want to go to the landing page of the Promise portal. The website is listed there on the slide, promise.dpw.state.pa.us. You want to select New Application from the Provider Enrollment section of the landing page, and then complete that application using the pharmacist's information and submit it. And again, keep in mind that that online application will not be available to you until March 1st. So this is a copy, or a picture, I should say, of the landing page. And you will see where there is an arrow pointing under the provider enrollment section to the new application. So that's where you'll access that application when you want to enroll on March 1st or thereafter. So at this point, I'm going to turn it over to Benita, who is going to go over the application itself with you. So Benita, it's all yours.
Good morning. Thank you, Lana. I am Benita Bishop, Provider Enrollment Supervisor for Pennsylvania Medicaid. And I just want to, first, before we get started, just go over a little background of exactly what it's needed. We received several questions in reference to enrolling before the training. So I want to point this out to you today. The department has received requests to allow pharmacists to enroll and be paid for services they provide that are open on the MA program fee schedule and within their scope of practice as permitted by state law. This will expand access to MA beneficiaries to receive pharmacist services such as immunizations and disease and medication therapy management, by allowing payment for those services rendered by the pharmacist in additional settings such as doctor offices, clinics, and other non-pharmacy service locations? This was one of the main questions that we received prior to the training today. And I want to point out to you, if you are already a pharmacist working with a pharmacy, you do not have to enroll separately. You do not need to submit a new application. So pharmacists working for a pharmacy would not enroll separately if they are going to continue to offer only the services currently allowed under the pharmacy enrollment. If you are planning to do additional services in other locations other than your current pharmacy, then you would enroll as a new pharmacist. There is no application fee associated with this enrollment. And if you wish to enroll, first you must obtain an NPI number, complete and submit the enrollment application to PA Medicaid, as we will go through in a second. And then credential with an MCO of your choosing, and then you must confirm your network participation. Okay. Before starting your application, we want to make sure that you have all of the documents and requirements needed for this enrollment. So if you're not sure exactly what the requirements are, you will go to this hyperlink, which is Provider Enrollment Docs, pa.gov. Here on this landing page at the top, you will see the words Provider Enrollment Documents, as you see here. And on this page, it lists every provider type that we enroll in numerical order. And if you see on the next slide, there is a copy or a example of what the page will look like. You see on the left-hand side, there are 3 provider types. You will scroll down to mid-level practitioner for provider type 10. Across from there on the right-hand side, you will see a hyperlink for the online application. And you will also see a hyperlink for the mid-level practitioner requirements. So you will click that, and on the next page, you will actually see the requirements. A mid-level practitioner has different specialty codes. You would be concerned with your specialty code, which is 247 for pharmacists. You will also see the provider eligibility program, which we consider the PEP, and you can choose which PEP for your application. Fee for service, which means you would like to have PA Medicaid pay you directly, or you would choose enrolled rendering only and enrolled not paid. These 2 PEPs are primarily used for FQHC or RHC, which is a federally qualified health center and a rural health center. Next, you will also see the requirement documents. So of course, you would submit your electronic application through the portal, the Promise portal. Please make sure that you have your current license from Department of State. If there is a DEA certificate, the same there, it must be current and not expired. If there is a pharmacist who works out of state, an out-of-state provider, you must submit proof of your home state participation with Medicaid. For example, Maryland is a next state over, and if the service location is for Maryland, you will have to submit your Maryland Medicaid participation with us. Okay. So afterwards, once you receive all of your documents that's needed, now you can move forward in starting your application. So you could either go back to the provider enrollment documents page and click that hyperlink there, or you can use the direct link to click the application. You would choose new enrollment and start your app. At the beginning of your application, you need to choose the program type, provider type, and enrollment type. Your program type is Pennsylvania Medical Assistance, PAMA. You are a mid-level practitioner for provider type. And in this instance, you are an individual with a social security number. This is your enrollment type. You will list your last name first name last, and then you will list your social security number, the complete social security number, 9 digits or 10 digits. If you are a Medicare participating provider, you will answer yes here, and then list your contact information. Please note, your contact information is extremely important. If there, for any reason, is an issue with your application, or if your application is returned for any reason, this is the information we will use to contact you. Your email address listed here is the email address we will use to return your application. So please make sure that this information is accurate and correct. Next, we have our service location. Please note, we do not enroll PO boxes. You must have a brick and mortar. So you would enter your street address, including your zip code +4. If you do not know the +4, you can always Google. But we do need the zip code +4, including your email and phone number. If you choose the Medicare cost share, you would, of course, just answer yes or no. I also would like to point out again, for multiple service locations, you must submit an application for each. We do not have bulk enrollments, so you will have to submit an application for each separate address or service location. On the next slide, we have our general and historical questions. First, starting off, asking if you will be performing services only as a ordering, referring, and prescribing provider. We also are asking about the exterior and interior steps leading to the main entrance, and this is for disability purposes. If the address is considered a rural health clinic or FQHC, a federally qualified health clinic. If it is, you would say yes. And then, as I stated before, in reference to the PEP, you will only be able to use enrolled not paid or enrolled rendering only as a PEP. If you are associated with Medicare, if you have been screened within the last 12 months, this is not considered a CHIP application. So in this case, the answer is no. And its answer is no for another state's Medicaid. And then you would move to your next page. In the center of the page, it's asking you if you would like to receive email notification for new bulletins. I encourage you to say yes, because if not, it would be your sole responsibility to make sure that you are abreast of all new releases of policies and regulations. If you say yes, this will automatically be sent to you on a regular basis. As far as your addresses, we give you the option for a mail to, for mailings, a pay to address for billing, and a home office. If you choose to have a separate address for these locations, you most certainly can. If not, you also most certainly can use the same service, the same address as your service location. Okay. All right, so in this slide, it discusses the specialties. There's only one primary specialty for a pharmacist, for that mid-level practitioner, and that is the 247. So as stated before, you will be considered a mid-level practitioner with a specialty code 247. Here you also list your license, and the issuing entity would be Department of State of PA. You would enter your license number, the complete license number, including all alpha and numeric characters, the issuing date, and the expiration date. And again, I must repeat, please do not submit or enter any expired documentation. The Provider Eligibility Program, the PEP, for this slide. The first question is asking you about a requested effective date. There are times where a provider needs to submit a prior date, or what we consider a back date. In that instance, you would answer the question yes. Once you answer the question yes, it would prompt you to upload a document explaining why you are requesting a back date. And also a back date is considered anything that is not of the date of submission. When you submit your application, that would be your effective date once your application is approved. So if you need a back date because of services rendered prior to your submission date, this is where you would say yes and submit documentation and an explanation why you're asking for that date. The associated PEP in this instance is fee for service because this provider is asking for PA Medicaid to pay them directly. Now, the provider identification. This page here primarily deals with the IRS and legal name address pertaining to your 1099. So wherever you want your 1099 mailed, this is the information that you will list here. It could be a service location or it could be a separate location as well. Also, there is the contact person as well. If there's an issue or if your 1099 is returned, we need to know who to contact to make sure that you receive your 1099, your IRS document. One extra thing I want to mention are W-9s. When we talk about tax IDs or legal IRS or legal names, we do not accept any W-9s whatsoever. Okay. And to continue on for the provider individual information, you will enter the date of birth, your gender. Your title and degree is not necessary. If you choose to put that there, that's fine. If you are board certified, again, if you are, if you say yes, you will have to upload that document. And then here is where you're going to enter your NPI information along with your taxonomy number. Please make sure your taxonomy matches the NPI for pharmacists and pharmacy services. In this particular case, the provider has a CLIA and a lab permit. If a CLIA and lab permit is associated with the application, you must submit both. You cannot submit one without the other. In addition, it must match the service location exactly. And of course, it must be current. So when submitting the CLIA, you must submit the CLIA and lab permit. They both must match the service location that you are enrolling, and it must be current. And I think I skipped over the Medicare claims. If you're asking the Medicare claims to cross over to this location, of course, that is your preference. You would say yes or no. And your DEA certificate. If there's a DEA certificate associated, if it is yes, then it will prompt you to enter that information. And then, of course, you will have to upload it as well. Additional information. Here we're asking for enrollment languages. If you speak an additional language or additional languages other than English that you communicate with your staff or patients, this is where you will list that there. Okay, and then there'll be a drop down and you can choose which language that you choose. For your fee assignments, here we're asking you if you would like to fee assign or link yourself to a group. If your answer is yes, as it is here, you will be prompted to enter the 13-digit Medicaid number of that business that you're or group that you're linking your fees to. This is actually stating that you are allowing PA Medicaid to forward your fees to the group, facility, or entity. And then that group, facility, or entity will pay you. Okay. If you want your fees to come directly to you, you will answer no. And also, I just want to explain again that the group that you will be fee assigning to, if you choose to, will be those businesses such as a doctor's office or a clinic that is separate from the location that you're already working in. And again, every service location that you render services, you must enroll. There is no limit to how many fee assignments that you can have. You can have multiple fee assignments, but you must be enrolled at those service locations. Okay. Here we have our provider disclosure questions. These questions are asking you if you have ever have any type of disciplinary actions taken against you, whether it's clinical privileges, revoked, denied, suspended, if you've had any judgments against you, any particular lawsuits pending against you or currently, if there have been any type of, in the last 5 years, drugs or any type of chemical substance abuse, you would answer these questions either yes or no. These questions here, if again, if you answer yes, you must upload documentation with an explanation. And continuing on the next page are the additional questions that are asked in reference to terminations for licensing, controlled drug licenses being withdrawn if you've been convicted of criminal offenses, and things of this nature. please, when you're doing your application, take your time and go through each question and answer them honestly. Once they are, as I stated before, if there's any question that you state yes, you must submit the documentation as well. Now, ownership and managing employees. Managing employees are not necessary for an individual provider. A managing employee or an agent is considered to be someone working on your behalf who is submitting your documentation, your application, and managing afterwards on your behalf so you can be enrolled with PA Medicaid. This is not necessary. You can work on your own behalf, but if you choose to, you would answer yes, and then you would have to list all of their information as well. There is no direct or indirect ownership for an individual. So in this particular instance, that answer is no. Again, it is asking in reference to criminal offense, if there has been any type of criminal, or if you've been convicted of a criminal offense related to Medicare, Medicaid, or any state health care program. And then the significant business transactions. This is only relating to if you're working with a supplier or a subcontractor within the last 5 years. And if so, of course, if you are, then it would ask you to list those things. Our attachments. Here is a list of pertaining to this application where we have indicated that we had some type of documentation that we needed to upload. In this application, we needed the CLIA and the lab permit, the Department of Health lab permit, and then of course the PA state license. And as you see there, the license number is also listed. Each document must be uploaded in a PDF form. That was the last thing I wanted to say. Okay. Now we're getting towards the end. Here we have the provider agreement. This agreement is between the individual, the pharmacist, and PA Medicaid. And here we're actually stating that you are or will agree to abide by all state and federal statutes, regulations, and policies. That if any information is requested by you, that you would submit to us within 35 days. If there is any type of ownership, that you must disclose your ownership, which is any person who owns 5% or more, direct or indirect, of a business. All information must be disclosed to provider enrollment. If there is needed for any type of background check, this is also stating that you will agree to that as well, as far as fingerprinting. In your case as a pharmacist, I don't believe that would be necessary. But this agreement states, even on the next page, as the agreement continues, it's also stating that, excuse me, that you can terminate your provider agreement. You or Department of Human Services can terminate this agreement at any time. If there's any changes to your provider profile, you also have 35 days to submit that information to us. And then lastly, we need a electronic signature in today's date. That signature would be the pharmacist's signature, not the individual submitting the application on their behalf, but the pharmacist's signature. and then of course the date. Now, once you have submitted your application, you will be able to download the summary again and confirm any details. You will also receive an email stating that we received your applications. In addition, when an application is submitted, it is not immediately received by Pennsylvania enrollment, Medicaid enrollment. It takes up to 7 to 10 days for it to go through verification checks such as Social Security before we actually are able to see it in our queues and to work on it. Just to let you know, once your application is submitted, there's going to be a little small lag time for those verifications to go through. Now, I know that I've said a mouthful, and I'm quite sure that there are questions. So we will pause now to see if there are any questions.
Hi, this is Lena. We have lots of questions in the chat. So I'm going to go through some of the questions in the interest of time. I do acknowledge that there are questions that I won't be reading out loud, but we will circle back for questions at the very end of the presentation. We'll also follow up this training with a list of the questions and the answers to those. The question and answer list will be posted along with the PowerPoint and a copy of this recording to the DHS website after this training. So with that, I'm just going to go back to the beginning of the question list. So the first one we have is the application for the pharmacy or the pharmacist?
This application will be for the pharmacist, the individual.
Thank you. The second question is the NPI for the individual or the pharmacy?
The NPI is for the individual.
We have a question about the MCOs. Are the MCO plans going to allow us to bill also, and how do we go about enrolling with them?
I'm not sure, Lana, did you want to answer that question? Do you know the answer to that question?
Well, with regards to the managed care organizations and their enrollment process, you would want to reach out to the plans after you've enrolled in the MA program. With regards to billing, the managed care plans themselves, again, that would be a question for the plans once you have enrolled successfully in the MA program. There is on the resources page of this document, and we'll go over it, a listing of the MCO plans and their contacts and enrolling information. So I would encourage you at that point to reach out to the plans. I don't know if Sandy has anything else that she would like to add.
So we did work with our Bureau of Managed Care Organizations to alert the managed care organizations about pharmacists enrolling. So we do know the plans are ready and expecting to have inquiries after March 1st.
Thank you. The next question is, do we also need to submit our license for authorization to administer immunization?
For this application, it is only asking for the Department of State pharmacist license.
Can you further elaborate on PEPs?
Sure. So a PEP is, there are 3 PEPs associated with this provider type. You have fee for service. Fee for service means you want to be paid directly from Pennsylvania Medicaid. You want to be paid directly from us. Enrolled, not paid means you are enrolled only. You only have a 13-digit Medicaid number. And as I stated before, enrolled not paid and enrolled rendering only are used primarily for facilities such as the FQHC or the RHC. In that case, you have a number and the facility will pay you. Medicaid would not pay you. Enrolled rendering only means you have your 13-digit number, but you want credit for the work that you do at that facility. Those are the differences for the PEPs for this provider type. I hope that answered your question.
Thank you. We have quite a few questions about Medicare. So the first one is, pharmacists are not recognized as providers under Medicare. So for Medicare participating provider, would all pharmacists enter no, or would we enter yes if our patients are enrolled in Medicare?
No, if you are not actively enrolled in Medicare, your answer would be no.
Could you further explain the pay to address? Is it okay to put the pharmacy address as the service address if I am doing off-site clinics, or should I use my home address?
That address primarily is up to you. You choose wherever you want your billing mailed. That is your prerogative. We cannot tell you where to send it to. You have to let us know where you want it sent, mailed to. So you have to choose where you want that billing to go.
Question about where the payment goes. So the payment goes to the pharmacist and not the pharmacy where the work is done?
If you enroll as a pharmacist and you choose fee for service, you will be paid directly. And remember, when you're enrolling as a pharmacist, you are enrolling in these other locations, additional locations that's not associated with that original pharmacy that you're already working with. So these are additional service locations where you're doing additional services. And if you choose to be paid directly, you will choose the PEP fee for service, and you will be paid directly, yes.
Right, there are lots of questions in the chat. Do you want to continue on with the presentation and we can circle back to the rest of them at the end?
Sure. So the next step, Lana, I'll go over how to resume or check your enrollment application status. So after you have submitted your application, and you need to go back or resume your application, this function allows the provider to resume the application that has been started but not yet submitted. Or you want to resume an application that was returned to you for corrections. Items that's needed to resume your application, you will need your tracking number, your FEIN, your tax ID number or social security number. In the example that we did for the application, it was the social security number. And then the password created when saving the application. I just want to point out where it says here the FEIN. I just want to make this a little bit clear for you. There are some individuals who work primarily under a tax ID number as an individual, not the business. So if you submit an application as an individual with an FEIN, a copy of that document should have your name on it only, not a business name. I just wanted to make sure that you understand the difference between the two. And on the next slide, you have to resume that application. First, you're going to go to the landing page of the Promise portal. And there's the website there, the promise.dpw.state.pa.us. And then you're going to select Resume Application from the Provider Enrollment section on the landing page. That'll be on the left-hand side. Next is the link. The link opens the window requesting the application tracking number, the tax ID or social, and then the password. So once supplied and verified, the provider can resume that application that has not been submitted or resume the application that has been returned for corrections. And then on the next page, you see exactly what I just stated. Here's the landing page. On the left-hand side where the red arrow, there's the hyperlink for the resume application. So you would click that. And then in the center, you would enter your tracking number. In our case, for the application we went through, you would enter that social security number and the password. You want to make sure that you check that you are not a robot and then submit. Okay, and then it'll take you to your application. The application status allows a provider to check the status of an existing application, either submitted or incomplete. Again, the same items are needed. You need that tracking number, the FEIN or the social, and then the password that you created when you started your application. So if anything else, it's very important to know what your tracking number is. So please make sure before you leave the portal or before you close out the exit, make sure you write down that tracking number, because if you do not write down your tracking number and it's not submitted, we only can see applications that are submitted. So if you call in, we won't be able to help you. You'll have to start a brand new application. So I must stress to you, please write down your application tracking number. Okay, and then same as before, you're going to go to the landing page on the Promise portal. And this time you're going to select application status, which will be on the left-hand side again. And then that link is going to require your tracking number, your tax ID or social, and the password. Then once supplied and verified, you can view the status of your current application, whether submitted or not. And then the provider can also view the application in the PDF of the submitted application from this page. So the next slide shows you on in the menu, there's on the left-hand side where the arrow is pointing the application status. You'll click that hyperlink. Again, you'll enter the ATN number, the social or tax ID, and the password. And then you can check that you are not a robot and submit. And then you see under that where it says the application status summary. Here you can click to download the PDF portion of the application, so you can keep for your records. Okay. And are there any questions?
Yep, we have some more questions in the chat. First one, can the pharmacy be reimbursed for services without an enrolled individual pharmacist?
So the pharmacies that are currently participating with us will continue to be able to provide all the services without having to enroll those pharmacists. It's really only if they want to do these additional services that that pharmacist would have to complete an application.
Right, scrolling down. How do we enroll for a taxonomy number? Is that the same as an NPI?
Yes, so when you go out to the NPPES website to get your NPI, you will also give a taxonomy code. When you're working the application, you're going to have a drop down to select the taxonomy code. So
Thank you. Sorry, my question list keeps jumping around, so I have to scroll to the bottom every time I want to look for another question. While I look for the next question, I'm going to punt it over to Michelle to see if she had any questions flagged that would be good to ask at this time.
There was a lot of questions around the CLIA, what it is, who has to submit it, who's required to submit it. Can you provide some clarification around the CLIA form?
sure. So the CLIA and lab permit is if you are going to be billing for lab services, we require that you have a CLIA certificate from CMS and a Department of Health lab permit. And with those submitted, you would then be allowed to bill for lab services.
There were also questions surrounding what is meant by Medicare screening.
I think we had heard earlier that pharmacists can't enroll with Medicare. So that's probably why the question about screening. But what we're asking is, have you gone through the ACH checks as a Medicare provider prior to completing this application?
And I'd just like to provide some clarification. There are some questions around MCOs. So today's presentation is to discuss enrollment in PA Medicaid. That is the first step that you need to complete. And then you'll need to work with those MCOs that you would like to partner with. So I just want to reiterate that again, that this is just for provider, your actual enrollment piece of it. We're doing the screening and enrollment. The actual credentialing and working with the MCOs, you will need to reach out to those MCOs individually. And I think we're good right now if you'd like to proceed with the presentation.
Okay, Lon, is it okay if I turn it over to you?
Yes, thanks, Benita. You did a great job.
Thank you.
All right, so let's continue on, and we're going to talk about the provider portal, how to register, and then also how to log on. So moving to the next slide. Upon approved enrollment in the MA program, providers will receive a 9-digit provider ID number that identifies the provider. We call it a master provider index number, as well as a 4-digit service location, which comprises the full 13-digit promise provider number. Now that 4-digit service location identifies the address of the service location that the provider is working at. Providers are going to need to establish a user account on the Promise Provider portal using that 13-digit provider number. And if you have multiple service locations that you have enrolled, you will need to establish a user account for each of your enrolled service locations. Now, to register a new Promise user account, you want to go to the landing page of the Promise portal. Again, the website, it's the same one. You want to click the Register Now link, which is located under the Login button on the Promise landing page or welcome page. And then you will receive the registration selector window. From the registration selector window, you want to select the provider option, and then you will complete a 2-step registration process. Now, there is a link on the landing page for the Internet User Manual. If you're having difficulty in establishing an account or navigating the website or the website itself, any information on that is in the Internet User Manual. It's a very good resource for you. So this is the landing page of the portal where you can see I have the Register Now link. So the very first time you want to go to log in, you have to create your account. So you want to click that Register Now, and then also just the red arrow at the bottom pointing to that Internet Help Manual. That's you can reference. Very good information in there. So once you click that Register Now link, as I said before, it's going to take you to this registration selector page where you will select provider. There are the other options there for an alternate, which if you have an individual that the provider has given authority to perform services on their behalf, they could create an alternate account, but you first have to create a provider account. And then billing agent and out of network, you don't need to worry about those. So once you select provider, it will take you to a 2-step registration process. You want to complete this page with your first name, last name. You will need your 13-digit Promise provider number that you're registering, as well as either the tax ID or Social Security number of the provider that you're registering, and then click Continue to go to the second step of the registration process. Now, on the second page of the registration, you will create a user ID and a password. You will also complete the contact information, including name, phone number, and email address. Now, this email address will be used if you need to have your password reset, or if you forgot your logon ID, we will send a reminder at your request to this email address that you have on file. You'll also need to select a site key token and give it a passphrase. This information will display on the password page once you want to log into the portal. You will also select 3 questions and then give them answers. And then you want to make sure you read the user agreement and enter your name into the please sign by typing your full name here field and then click submit. If all required information is present, you will gain immediate access to the portal. So in order to log on, after you've completed the registration process, to log on to the Promise portal, you want to go to the landing page, enter in your user ID. You will then be prompted to answer the challenge question and then enter your password to gain access to the portal. So here's where you will enter your user ID that you created upon registration. Click Login. You will then be taken to the challenge question page where you'll enter the answer to the challenge question that's presented. You will notice that there is the select, those little buttons there that says select. This is a personal computer or a public computer. If you do select the personal computer, then on future logins, this page will be skipped for you. Additionally, if you forgot the answer to your challenge question, there is a prompt there for you to select forgot answer to challenge question, and it'll take you to a screen. So hopefully you'll be able to remember what it is. And then you want to click continue. It will then take you to the page where you will enter in your password. So this is the page that does display that site key token that you selected in the passphrase. You want to enter in your password that you created and then click the sign in button. That will then take you to the My Home page of the portal. Again, if you forgot your password, you can click that forgot password link. And as I said, it will allow you to reset your password, and the information will be sent to the email address that you used in the registration process. So any questions on that registration process or the login? Okay, so let's move on to the My Home page. So once you have successfully logged in, providers will be able to check the recipient's eligibility. You'll be able to submit claims or check the status of any claim that you submitted. You'll be able to retrieve and review your remittance advice statements. You'll be able to review your enrollment summary information. You'll also have access to enrollment applications if you need to add a new service location or you need to do a revalidation application in 5 years. There's also some links to the DHS website. There's also a link for providers to be able to look up other enrolled providers. And then also, if you wanted to, you have the ability to enroll in electronic funds transfer if you would like to receive direct deposit into your banking account for your reimbursement. So this is the My Home page of the portal. You can see where that arrow is pointing to the menu bar. That menu bar will display on each page of the portal. You see we have the My Home page, and then right underneath that, the enrolled provider search. So if you were in need of looking up to see if a provider is enrolled in the program, you can use that enrolled provider search. Because remember that all providers who render services, who order, prescribe, or refer have to be enrolled in the MA program. So that's why we have that enrolled provider search option for you. There's also that link for EFT, which stands for electronic funds transfer. If you wanted to sign up for direct deposit, you would click on that link. There's also a link to electronic remittance advice, enrollment, or ERA. If you are billing electronically with some sort of software or a clearinghouse or using a billing service, then that might be something that you would sign up for. But normally, if you're going to be billing on the portal here, you do not need to sign up for ERA enrollment, but you might want to consider electronic funds transfer. So additionally, on that menu, we've got claims where you'll be able to submit a claim or do a claim inquiry. There is the link to check eligibility. Trade files not utilized by pharmacists, so you don't have to worry about trade files. Reports is where you would retrieve that remittance advice. There is a link to the outpatient fee schedule. Hospital assessment, which again is not applicable to pharmacists, and then help is self-explanatory. And then there is log out in that upper right-hand corner there, if you can see that. Moving on the left-hand side of the screen, we do have the name of the provider, and underneath that would be the logon ID. The provider's NPI number would also be listed here, and the service location, the last 4 digits. The My Profile tab will allow you to take a look and make updates to your logon credentials that you created. So if you clicked on the My Profile tab, it would allow you to update your contact information if you needed to. It would allow you to change the answers and questions if you wanted to change those. It would also allow you to change your site key token and passphrase, as well as your password. So that's the My Profile link. With regards to manage alternates, again, as I said, an alternate is an individual that the provider has given authority to perform services on their behalf, such as billing, checking eligibility, maybe enrollment. So you would need to sign up any individual using that manage alternate, and then manage billing agent. You don't need to worry about that. There is that provider services section there. So that's where you can review your enrollment summary. If you needed to enroll a new service location, you can click the new service location link or revalidate. If in 5 years you're going to re-enroll or re-up your MA enrollment, you would click revalidation. There's also a link there for change requests. If you have some changes to your enrollment, that change request does allow you to do some limited updates to your enrollment. Of course, the resume application and the application status links are there. If you require help with your application, there is that application help link, and then the terminate enrollment if you no longer wanted to participate in the program. Down at the bottom, there are some links that will take you outside of this website to the DHS homepage or the DHS provider information page, as well as the provider enrollment information page, or for CHIP providers, their enrollment information page. It's very easy to navigate the site. You'll just click those links across the top. And there's always, as I said, the My Home page that will bring you right back here. So moving on. Let's talk about checking eligibility of an MA recipient. So in order to check eligibility of a MA recipient, you will need to have certain search criteria. And it is extremely important that you do check eligibility of the individuals to make sure that they are eligible for the services that you want to provide to them. You will need their recipient ID number, that is their 10-digit ID number, and their card issue number that does display on their access card. If you don't have that, or they don't have that, you can use their recipient ID number and date of birth. But if you don't have that information, or the recipient doesn't have that information, you can use their social security number and date of birth to check eligibility. or their name and date of birth to check eligibility. If you do check eligibility and you use their social security number and date of birth, or their name and date of birth, in the response, if there is a response coming back, it will provide you with their 10-digit recipient ID number, so you will be able to bill, because that's the number that you will need to bill PAMA. And then, of course, you'll also need the date of service to check eligibility with. So in order to access the eligibility screen from that menu across the top, you want to select eligibility, and it will open the recipient eligibility verification window. Here's where you will enter in the 10-digit recipient ID and that card issue number if you have it, or if not, the recipient's 10-digit ID number and their date of birth, or their social security number and date of birth, or their name and date of birth. And then the required field is the date of service. The default on the system would be the current day. You can verify eligibility for any date in the past, but you can only do a 30-day search window. So you can't go from today's date back to December of 2023. It's not going to allow it, and it would stop you. Also, you can verify for a future date of eligibility, but you can only go to the end of the current month. So for example, we could go from today's date, February 15th, through to February 29th if I wanted to look at a future date of service, but I can't check March eligibility until we're actually in the month of March. You will also see on the screen there's some optional fields, and I am going to ask that you leave those blank. They are not required. So just stop at the date of service and then hit search to receive your response back. Now, the response that you will receive, if we move on, so this would be an eligibility result or an example of an eligibility result for an individual who has fee-for-service or medical assistance coverage. You will notice at the top of the response, we give you the name of the recipient, the recipient's ID number, their date of birth, and the gender. Then you will see the eligibility summary information display. You will notice that we've got the type. In this instance, they've got 2 Medicaid types. I have highlighted there in red the service program, which is HCB01. And that I have on the right-hand side of the screen a bulletin that will help you determine what that service program covers. So you would want to refer to 991801 bulletin, and there's a chart there that will give you information as to whether or not that service program is covered for the services you're going to provide. There's only 5 service programs that are MA eligible. You'll also notice, though, on this screen, the other or additional payer information, and we refer to that as TPL, or third-party liability. So when you are checking eligibility of an individual, if they have other insurance coverage, that is going to display as other or additional payer information. If the recipient is enrolled in an MA managed care plan, that will also display in the response. And if we go to the next slide, you will see exactly what that looks like. So here, again, where we are seeing the Medicaid coverage, you will also see managed care as the type. Now, you'll notice on this particular example, we've got 2 managed care. One of them says that BHNS for community care. So anytime you see managed care with the BH, that indicates that's their behavioral health coverage. And then that's who you would want to participate with and bill if you were rendering behavioral health services. Obviously, these services that you're providing are the physical health coverage, and that's why I have highlighted there in red the managed care with the physical health or PH, letting you know the name of the plan. Now, be mindful of the fact that if you don't participate in that plan, you might not receive reimbursement from the plan for those services. So it's important that you look at this and say, oh, I do par with that plan, so I can go ahead and provide those services. So that's where you're going to get the information of if they're enrolled in an MCO plan, and again, if they have other insurance. So that would be the information with regards to the eligibility. Can move on. And let's talk about the provider billing. Now, I do.
Before we go into billing, let's kind of clear up some of the questions regarding enrollment piece, if that's okay.
Sure.
So there's a couple questions related to FQHCs and how if a pharmacist needs to enroll independently, or can they be assigned to the FQHC, or how does the FQHC enroll a pharmacist?
I was talking on mute, I apologize. For a pharmacist who is working out of an FQHC, they're going to go ahead and enroll as a pharmacist. And then when it comes to the program eligibility choice, they're going to be enrolled, not paid. But it is the same as any other practitioner working out of an FQHC as far as enrollment is concerned.
I want to add to that, as far as the FQHC or the RHC, that is the only way that you, a pharmacist, can enroll. So you will not be receiving fees directly to yourself. You will only be enrolled not paid or enrolled rendering only. That's only for the FQHC or the RHC.
Thank you. There are a couple more questions in the chat. Is there a clear list of billable services and codes?
Yes, there is, and we will review those in just a moment for these new services. Correct. There's a bulletin out there, MA Bulletin 102401, which does contain a listing of the procedure codes billable by pharmacists, provider type 10 with the 247, as well as, and I'll show you in the next couple slides where you can go out to the DHS website and they're listed out there under the MA fee schedule as well.
Thank you. There are a couple of questions about the provider portal. The first one, is registering on the provider portal a requirement?
Yes, if you're going to, well, it's not a requirement if you're not going to bill on there, but I would highly recommend it to check eligibility, although you might be able to check eligibility some other way. With regards to billing, I mean, if you're going to use some software or clearinghouse, you don't need to register, but to retrieve your remittance advice statements, that's the only place that you can get them. And we'll review the RA statement for you in just a little bit. So, but it's not required. I mean, you don't have to if you have other means to bill and check eligibility.
Thank you. The next question, if I have an individual promise ID already for tobacco cessation provider, how do I proceed? Do I need a new application or can I adjust my current promise ID?
So you would have been enrolled as a 37,370 for the purposes of tobacco cessation. So you will need to do a new application as a 10,247, and then we can add the tobacco cessation specialty to your file post enrollment.
Thank you. What is the 13-digit provider ID?
Well, that's the number that is assigned to the provider upon their enrollment. The first 9 digits would identify the provider. So if you're Pharmacist Smith, then that 9-digit number would be identifying Pharmacist Smith, and then the last 4 digits denote the service location. So let's say you have an office you're going to practice in Hershey, then say the service location would end in 0001. That would denote your Hershey office. If you were going to open up another office or practice in, say, Harrisburg, then you would get another service location for that site as well.
Thank you. Is there a cost for enrollment application?
There is no cost for an individual pharmacist to enroll in the program as the provider type 10 with the 247 specialty. So no, there is no application fee. I don't know if the department wants to expand on that or not.
Oh, you answered that perfectly. Thank you.
Thanks, Sandy.
And then one question about checking eligibility. Is the recipient ID number on the access card?
Yes, the recipient ID number does appear on their access card. Depending on which card they have, the white card with the white card with the flowers, if that makes sense, that card does specifically have recipient ID and their 10-digit recipient ID number. If they have, no, that's the if it's, oh God, I'm screwing up here. If it's the white card and it has flowers on it, that I believe is the EBT card. Their recipient ID number, there is a number on that card. It's 19 digits long. The first 6 numbers are the bank routing number, and then their 10-digit recipient number is following that first 6 digits. If they have the white access card, it does say on their recipient ID number. So yes, it is on there in conjunction with that 2-digit card issue number. So they are on there.
Thank you. We can continue with the presentation. Before we do that, Sandy, is there any additional information you wanted to provide?
Yeah, there are quite a few questions coming in about pharmacists assigning their fees to the pharmacy. That they can do if they are, once they look at the bulletin 102401 and they determine that they're going to provide these additional services, the pharmacist would enroll, and then they can fee assign to the pharmacy that they're working at. So hopefully, once we move on here with the billing, this becomes crystal clear, but we do know we're getting a lot of questions, and a pharmacist can fee assign to a pharmacy. So we can move on.
Okay, thanks, Sandy. So let's talk about the billing on the portal. Nope, you were good. Thank you. So pharmacists are going to bill for these services, okay, using a CPT code, and you will use the professional claim form. Now, the regulations state that all providers must submit an original claim form within 180 days from the date of service. And if you need to do resubmissions of denied claims or submit adjustments, they must be submitted within 365 days from the date of service, or they will be denied. Now, with regards to those compensable procedure codes that you all are interested in, there is the MA Bulletin 102401 that does have an appendix, and it has a listing of all the compensable procedure codes for these new services that you might be providing. You can also click the link there for the medical assistance fee schedule. It is on the DHS website, and it will take you to the fee schedule where you can search for procedure codes that would be compensable to your provider type. So on the next slide, this is just a screenshot of that online MA program fee schedule. So you can do a search on your provider type and then your specialty. And if you had a specific procedure code that you wanted to look up, you can put that in the search option, or you can just do a search on your provider type 10 with a 247 specialty. And then in this case, you're going to receive 192 results. So this is where you can locate your procedure codes. So we can move on. So accessing the professional claim form, again, from that menu going across the top, there is the link for claims. Once you click that, you will see underneath it where there is a link for the various claims we have, claim inquiry being the first one there on the far left. And then what you're looking for is the professional claim form when you're billing for these services using the CPT codes. So you will open up that professional claim form. You can move on. Now, in completing this claim form, there are several fields that you'll notice that, first of all, this is the, I had to break the claim form down onto various screens. So for the next several screens, it's going to be just a continuation of the professional claim form. You will notice some of the fields have arrows pointing down, and that would be a selection from the drop-down list. You will notice at the very top, we have the billing provider number there, the NPI, the taxonomy, and the zip code listed, and that would be the provider that would be receiving the reimbursement. There are also some fields on here that are required. And Sandy, do you mind just going back to the previous screen for me, please? So you will notice that some of these fields underneath, thank you, by the way, underneath these fields, it is marked in red that it is required. So just be mindful of that, that it will let you know what fields are required on this claim form. So thanks, Sandy. We can move on to the next slide. So here, what we do need is the 10-digit recipient ID number that is required, the patient account number, which is anything that you want it to be. If you use account numbers in your practice, you can put that in that provide a patient account number field. It is anything you want it to be. The field is 19 characters long, alphanumeric combination of both. You'll notice that the name, last name, first name, and middle initial is not a required field. If you wanted to put that in there, you can. Otherwise, you can leave it blank, and nothing is required on the right-hand side of the screen. You will need to give us a diagnosis code. You will make a selection from that code type dropdown. It will always be ICD-10. Next to where it says diagnosis code is a little add button. When you click it, that box will open up and you will need to enter in the diagnosis code. No decimal points in that diagnosis code. Moving on, as we scroll down through our claim, there is a section for anesthesia and condition codes. They are left blank. What's required in the service information section is the rendering provider ID. That would be the pharmacist who is performing the service, your 13-digit promise provider number, and then your NPI number. You will also need the referring provider's information with regards to their medical license number, as well as their NPI number. To the far right, there are two fields that are required: the release of medical data and the patient's signature. Both of those fields are selection from a drop-down list. None of the choices in the drop-down list are incorrect, so just make your appropriate selection. And nothing else then would be required in the service information section. We also don't need anything in the accident section or the ambulance section of this claim form. So we can move on. The newborn section would only be completed if you were billing for a newborn and you were using the mother's recipient ID number. I don't foresee that as something you would be doing, so we mostly would leave that blank. The other insurance section would be completed if there is other insurance, because remember, MA is always the payer of last resort. So you have to bill every other insurance benefit or resource before billing the MA program. So if there is other insurance, then these fields would be completed. You want to click that add button and it will open up these fields for you, where you then would make a selection to complete them with the carrier code, the individual relationship, release of medical data, benefits assignment, claim filing code, and the patient signature. But if the individual just has medical assistance, then these fields would be left blank and we would move on to our service lines or detail lines. Now, on this section of the claim form, you will notice that there is that box at the top and then fields below. How this works is we actually complete the fields below and they will populate that box above. You'll also notice that there are two buttons to the far right of that box that say add. If you need to add additional detail or service lines, or delete if you have a service line there and you don't want to bill it. So in this example, we're just billing for one service on one date of service. We are entering in our from and to date of service as the same. The place of service is a selection from a drop-down list. In this case, we're using office. The procedure code that you're billing for, that's on the fee schedule. If there are any applicable modifiers, they would be noted on your fee schedule. So you would want to look at that to see, are there modifiers that I would need to use? If not, please don't put any there. The diagnosis pointer, we ask that you indicate a 1 there. And this just pertains, when you put a 1, it just pertains to that primary diagnosis code that we entered up above. Now, by the way, you can have more than one diagnosis code. You could have potentially up to 12, but you really only need one on a claim form. Units are required, so how many units you're providing. Normally, it would be 1 visit. And then the billed amount would be your actual charge, what you would charge the self-paying customer. We don't need anything in those additional fields for family emergency or family planning, EPSDT. The contract type, code, or version, we want to leave those blank. At the very bottom where it says service adjustments for service line 1, those fields would only be completed if there is other insurance and you're addressing what the other insurance has done, that you've billed them and then maybe they've applied it to their deductible or co-insurance. As I said, if you have additional services that you would like to bill for, if you click that add button, these fields will refresh and you'll get additional service lines. The claim form itself holds up to 50 service lines, although I don't know that you would want to sit here and bill for 50 different services at one time, but you could. Otherwise, if that's all you're billing for, you want to drop down to the next screen and you will have the ability to submit the claim form. You will see that the claim will be processing depending on your browser. Sometimes you'll see it spinning in the upper right or the upper left-hand corner of your screen, and then you will receive a response back, and that's what this claim status information window does display. There are several statuses of a claim. Approved, which means that your claim has been approved for reimbursement. Paid indicates that the claim has, that it was a paid claim and you've already gotten the payment, which is what we have here on this slide. Suspended, if your claim is in a suspended status, that means that it is being held for a manual review by DHS or Gainwell staff, and then finally denied, and that would indicate that your claim has been denied. You will notice that the claim has an ICN or an internal control number, so every time you submit a claim to us, we give it an internal control number. It's our way to be able to process, track, and then report that claim back to you. If the claim is paid or in an approved status, we're going to give you how much we're going to reimburse. And then here, because the claim is paid, we have a paid date, but if it's approved, you won't have a paid date there as yet. Down at the bottom, you will see the error status codes or ESCs, and then the disposition. The error status codes could be paid, suspended, or denied. So again, if your claim is in a denied status, then it would have an ESC there, and it would, let you know why your claim is denied. Maybe you didn't bill it timely, so you have a denial on a timely filing in it. Maybe you don't have the right procedure code, or you're using the wrong place of service. And so there are a lot of ESCs that we have. You will notice that there is also the option there to do a new claim. So if I click on new, it'll just bring me a brand new claim form. Or if I do copy, it's going to copy the claim form that I have displayed up above. Honestly, you don't really need to utilize those two features. You can just edit the existing claim. You don't need to do a new claim or a copy. So we'll move on. Now, with regards to billing for vaccines, so pharmacists can bill for the vaccine ingredient cost or the biological that they've used, and that would be billed using either the NCPDP transaction if you're billing electronically. If you're using your software and they have the capability to submit an 837P, you can submit an 837P or on the Promise Internet. And in that case, if you're billing for the biological, you will need the NDC as well as the accurate number of NDC units that you provided. A separate claim form would be used to submit for the administration fee. And again, that would be using the CPT code and submitting that on the 837P transaction or the professional claim form on the internet, or if you wanted to go on paper, CMS 1500 claim form. So in that instance, we're looking at two claims, one pharmacy claim, and for the actual ingredients that were provided or the cost of the drug using the NDC, and then another for the admin fee with the CPT code. And you can move on. And this is just for those pharmacists, this may look familiar to you that use the portal today. So this is just where you would obtain that pharmacy claim and then complete it for the actual biological that you dispensed using the NDC. So that's what this form looks like. We can move on. The remittance advice statement. So before I move on to the RA, are there any questions with regards to the billing?
Yes, there are quite a few questions. I'm just going to pick out a few now, and we can circle back to the rest of them in our Q&A. What is the average time to payment for clean claim submissions?
Routinely about 21 to 28 days. I will say that if you have EFT set up, that's actually the fastest way to get the reimbursement. But, you know, if we're mailing a check to you, it may take longer, but on the average, about 21 to 28 days. Sometimes sooner.
Thank you. Can pharmacists who work in a hospital setting assign their fees to the hospital?
Sandy, I don't believe they can, but I'll throw that one to.
Yeah, so if they're working out of a hospital, the fees wouldn't be assigned to to the hospital, but a physician group within the hospital, so they can be assigned to a 31, but not to entity 01.
Thank you. The next question is, can the billing be automated through our EMR Epic, or must it be submitted through the portal?
No, you can certainly use Epic or which would be a software vendor. You can use a billing service. You can run through a clearinghouse. So no, absolutely, they can. They don't have to use the portal. They can certainly use their software if they like. Sure.
Is the referring provider entry required for self-referred patients?
Sandy, you want to take that one? I don't believe they can be self-referred.
Right.
I think they have to have a referring.
Right. We would expect that a physician would be referring. As mid-level practitioners, there should be a physician that you work with. So that's who we would expect to see in the referring field.
If the patient has another payer, why would we bill in the portal? Would we not bill through the other payer's portal?
Correct. So if there is, and I'm guessing they're talking about another insurance. So if there is other insurance, commercial plans, say they've got a Highmark plan or UPMC plan, of course you would be billing through their avenues of billing first. You would bill MA only if when you billed primary, if maybe they denied the service, maybe they're not going to pay it, then you could bill medical assistance, or you bill them primary and maybe they apply everything to deductible so you don't get anything, or there's a co-insurance involved and you feel that there's additional reimbursement owed to you by MA. That's when you would bill us. With regards to the PA MCO plans, so if they have coverage through AmeriHealth Caritas or Geisinger Family Plan, then of course you wouldn't be billing on the portal, but you would be billing through their billing entity and not on promise.
Okay. There's a question here. In the case of dual eligible patients who have Medicare Part B or Medicare Advantage plans as their primary insurance, with PA medical assistant secondary, the primary plans may not recognize pharmacists as providers of these services. Are these patients still eligible for the services under Medicaid? And if so, how should we address the primary billing info when we're not able to bill their primary plan? I think this relates to the question you just answered.
Correct.
Yeah, okay. And that's all I'm seeing right now. We can continue with remittance advice.
Thank you. So we can move on to the remittance advice statement. So the remittance advice statement explains the status of claims and claim adjustments that were processed during that particular payment cycle. The claim information is arranged on the detail page of the remittance advice statement in alphabetical order of the recipient's last name. And keep in mind that if you have more than one service location as a provider and you submit claims under multiple service locations, then there will be a separate RA statement for each of your service locations. In order to retrieve the RA statements and review them from the My Home page, just simply select reports, and there is only one report available to you. So you can click reports, and then the next slide, please, screen. It will then allow you to enter in your search range criteria. It says there you can view a 90-day search criteria. The RA statements are kept on the system or on promise for 2 years. So you can go back 2 years in the past and get them. But when you are searching in the past, just make sure you stay within the 90-day search window. You want to enter in your date range here and then hit request reports, and you will see that the RAs that were generated during your search request timeframe will display on the left-hand side of the screen with a date. You simply want to open it up, and then it will display your RA statement for you, which is just a listing of all of your claims that were processed during that particular cycle. So Sandy, that's on that next slide. Keep in mind that if you didn't bill during that cycle, you're not going to receive an RA statement. So this is, as I said, a list of all the claims that were processed, giving you the name of the recipient, the service that was billed, the date of service, what you billed, and then your reimbursement amount. You will notice there on the far right the explanation codes and the status of the claim. Keep in mind that I didn't show it on in the presentation, but there a final page on the RA statement that details all of those error status codes and what they mean. So when you're reviewing it, if you're going, well, what's a 4036? I have no clue what that means. On the final page of the RA statement, it will explain what is a 4036. There's also a summary page on here as well, which I didn't display. I'm only showing you the detail pages, but there's a summary page which will give you your year-to-date totals and also how many claims and claim adjustments were processed during this cycle and what we, how many were paid, how many denied, and your reimbursement. There is also a provider quick tip that's out there. It is number 07 that does review the RA statement in more detail. So it'll give you some like detailed information about what each of these fields are on there. So that's another help for you. So we can move on. And we'll talk about resources. So let's finish up with our resources. Again, to get that application, you want to go to the promise.dpw.state.pa.us website. And that's also where you can go to, that's the portal, and that's where you can also go to do your billing, check eligibility. We also have the provider enrollment information and training materials. So the link for the enrollment information includes requirements for each of the provider types. And as Benita went over in her portion, the provider enrollment documents, and that's where these training materials will be displayed. So you'll be able to listen to today's presentation there. We also have the provider enrollment and screening requirements of the Affordable Care Act. So if you're interested, please visit the ACA for providers. That includes the most current information from the department regarding the ACA federal required mandates. And then there's also a link there for Medicaid information, which provides information about the ACA federally mandated regs and then how they relate to the Medicaid program. On our next slide, we have a link to the DHS website. Now on this website, this is where you will be able to review that fee schedule. Also on the website, we have MA regulations out there, MA bulletins are out there. Again, the enrollment information is available to you. So lots of good information on the DHS website. And then I did include the two links. One of them is for the provider quick tip on quick tip number 265 on how to check the status of your electronic enrollment application, and then also quick tip number 070 concerning the remittance advice statement and if you have questions on it. The bulletins that we discussed with regards to pharmacies, billing and enrollment in the medical assistance program, the 102401, as well as 102402. And then I also included the medical assistance program vaccine desk reference. That's out there in MA Bulletin 992401. Also included is the DHS Provider Services Center. This is the phone number that you can call for enrollment. You can also contact this number if you have billing issues or questions. And then I wanted to mention it to you earlier, but we do offer providers one-on-one billing training. I know we went over that information rather quickly with regards to checking eligibility or how to bill or navigating the site. So if you need some additional one-on-one training, we can set that up for you. You can email us at promise.providertraining@gainwelltechnologies.com. When you do that, please include your name and your new provider number, and we can set that training up for you. We do ask that you have a client or patient before you ask for training, because we'll need that live information. We'll actually go through and do your first claim submission with you. So we ask that you wait, don't call us and ask for training unless you already have someone that you're seeing and need to bill for. And then finally, the MCO directory, which does contain a listing of the MCO plans as well as their contact information. So you can review those to see if you want to enroll in any of those plans or which plans you want to enroll in. So that concludes our formal presentation for today. So I'm going to turn that back over to Lena and Michelle for the questions. Thank you.
So in recognizing that we have lots of unanswered questions in the chat, we are going to answer those questions in writing and post the Q&A to the DHS website along with a recording of this training and the PowerPoint for you to view. So your questions will be answered in a document on the DHS website. We will be able to provide you with a link to the DHS website once it has been posted. We do thank you for your participation today, and thank you, Benita and Sandy and Lana, for your wonderful presentation. I think it was very helpful for everyone.
Thank you.
Thank you.
Thank you. So before we totally end, just a reminder, the enrollment for provider type 10-247 will be open beginning March 1st. These are for pharmacists who are looking to provide these services, maybe from a setting other than a pharmacy, such as physician offices, hospitals, FQHCs, or if you're currently working in a pharmacy and you want to do some of these additional services that are listed on the fee schedule, look at Bulletin 10-2401. And if there are additional services that are available under the 10-247 and your pharmacy wants to have you perform those services, then you would also need to enroll. But if you're working in a pharmacy and already doing the vaccinations and aren't going to expand your services, then you do not need to enroll as a pharmacist. Thank you.